Good morning, everyone. Thank you for joining us today for another CNIC virtual event. Education, as many of you will know, is a foundational pillar of the CNIC. So today's academic forum is a little unique. It's designed to be a bit of an open platform to enable better alignment and communication between our academic partners and the broader isotope industry and healthcare institutions that we work with within the CNIC umbrella. As I mentioned, today's agenda is quite unique compared to some of the other CNIC online events that you may have attended in the past. This time, we are going to be inviting participants to turn their cameras on, unmute yourselves, and engage directly with our presenters today. But please keep in mind that we are recording the session, so keep yourself muted when you're not speaking, please. The recording will be available on our website in the next few days in case you want to check out any of the presentations again, or if you have to log off early. Just a bit of an introduction before we dive into our first presentation. The CNIC has grown over the last few years to reach over 115 members now, and we're very proud to have several leading academic institutions as part of this network. Each of our institutions is doing really amazing work to build a strong workforce for the future. So the focus of this academic forum is to increase awareness for what some of these academic partners are doing to train the next generation of isotope leaders. However, these initiatives, as we know, can be so much more successful with alignment and support from the broader industry. So this forum is also a platform for our academic partners to highlight what they're going to need from all of you to help fill in the gaps. For those of you who are industry or health partners, or for those who are representing other institutions joining us today, you don't just get to relax. This forum is also your opportunity to raise your perspectives to the academic institutions that are presenting today, such as where you see opportunities to get involved, potential gaps, and where you see the growth going in the future. We know that innovation and success will come when we work together. So today's forum really is an opportunity to increase the collaboration and knowledge sharing right across the sector. So let's get started with our first presentation. After each presentation, we will be opening it up to the audience for a few minutes for comments or questions. So please be sure to keep those in mind as we go through the presentations. First up, coming to us from Southwestern Ontario, Western University is a leader in nuclear medicine education and research, offering programs in biomedical and nuclear engineering, health sciences, and imaging. Western partners with the Lawson Health Research Institute and London Health Sciences to provide hands-on training in isotope research and radiopharmaceutical development. To talk more about Western, please welcome Erin Azzopardi, Director of Strategic Partnerships at Western University.
Awesome. Thank you very much. That was a great introduction, and I think highlighted a couple of things I want to say already. So thank you very much, Melody. I'm just going to say, can everybody see my slides? Is that perfect? Okay. Well, I'll just start off by thanking the CNIC team for hosting today's event and inviting us here to speak. I'm really honored to be able to provide a really high-level snapshot of some of the activity and research capabilities that exist here at Western alongside some of our partner institutions. If you take nothing away from my presentation today, I hope you at least are excited about some of the capabilities and work being done here and know who to contact if you would like to learn a little bit more about some of the things I mentioned or be directly connected with the expertise here on campus. And so I'll share my information along with my colleague, Kate Placid, who's our lead in medical imaging, who some of you may know already. And we would welcome continued discussion or in-depth discussion after today's presentation as well. So for those of you who may not be familiar, here's a little Western 101. We are a large comprehensive research university. We're ranked among the top 1% of higher education institutes worldwide. We have a fairly large student body with over 43,000 students and a number of degree and graduate degree programs across our 12 faculties, plus our School of Graduate Postdoctoral Studies that include professional programs in both medicine, business, law, and engineering. Western University is deeply integrated with the London healthcare ecosystem. So University Hospital is located directly on main campus, and we also have strong partnership with Victoria Hospital and London Health Sciences Centre and St. Joe's Hospital and Healthcare London. we are, because of this deep integration and collaboration, London, Ontario is an attractive hub for healthcare innovation. We bring together talent, infrastructure, partnerships, and market access in a way that few mid-sized cities can match. So to begin and give a little introduction of what we're doing specifically within isotopes, I'll introduce Western's Nuclear Hub, which is an informal cross-campus initiative driving innovation within nuclear materials and nuclear energy. This is based on 3 areas of research excellence, with the most relevant, of course, today being isotopes. But we also do a lot of work in nuclear waste and nuclear energy. The Nuclear Hub was created with the aim to advance research and talent development and integrate academia, industry, and government in a way that supports national capacity and ecosystem growth, which we know is a strong need within the nuclear and isotope sectors. Just in the space of time and concerns of time, I don't have time to go into what Western is doing across our entire university, but I do want to highlight that we are working and doing research and have facilities that are relevant across the theranostic pipeline. So we have strong expertise in diagnostic imaging across a number of different imaging modalities. We can visualize disease at the molecular level all the way up to whole body systems. We're doing a lot of work in target identification, whether that's identifying biomarkers or receptors that can be used for therapy targeting. We're supporting radiopharmaceutical development, and there's a couple of examples here, as well as the delivery of innovative and new tech therapies, and I'll provide an example of Pluvecto in the next couple slides, as well as supporting the monitor and follow-up care of patients post-treatment. So that's a very, very comprehensive pipeline. So it's probably no surprise to anyone here when I say that this is done across a number of different areas on campus. And again, this isn't comprehensive. It's just to show you some of the breadth. We work in a couple of key areas, with our core strengths being in radiotheranostics, nuclear imaging, radiochemistry, and the applications of AI in imaging, as well as isotope production and applications. This is largely led through our Schulich School of Medicine and Dentistry. I've given a couple of departments, again, not comprehensive, and our research centers, and I'll do a deeper dive on some of these in the upcoming slides. But I want to note this isn't just in our School of Medicine and Dentistry. This is across a number of different units, including the Faculty of Engineering, Science, Robarts Research Institute, and in strong partnership with London Health Sciences and Lawson Research Institute, with many of our faculty and scientists being cross-appointed across all of these different institutions, and which really helps cement that collaboration and interdisciplinary integration. So I'll start with a deep dive on our Department of Medical Imaging, which again is kind of a hallmark of that collaboration I was talking about. Some of the leaders here, like Marinder Paul, is our citywide chief of medical imaging, and I think has a cross appointment in almost all of the slides and logos I just showed you. But this department has had a number of successes. Most notably, they were the London Health Sciences Centre was the first to administer the publicly funded medical isotope Pluvecto, a radioligand therapy for prostate cancer. This was led by Dr. David Laidley and in partnership with Novartis, and was recently recognized by CNIC with a Health Champion Award. The department has a number of successes. I won't go through all of these in detail as you can see them, but it is the largest Royal College training program in nuclear medicine. It has leading fellowship programs, including one specific to theranostics. It has an integrated clinical experience with the broadest nuclear medicine and theranostic practice in the country, with deep expertise in hybrid imaging innovation. It has the nation's most complete oncology program for thyroid, neuroendocrine tumors, prostate, and Y90 liver cancer, as well as a clinical research unit directly embedded within the nuclear medicine and MIT program. As a highlight of some of the facilities that exist here at Western and in our partner institutions, I'll start by introducing the Nordal Cyclotron and PET Radiochemistry Facility, which is actually a part of Lawson Research Institute and housed at St. Joe's Healthcare London. This is a full suite cyclotron facility with clean rooms, GMP labs, GMP testing and quality control labs. This does produce short-lived PERS for St. Joe's PET scanners, but I think the takeaway message here is that it supports both clinical and translational research. So if you are interested in learning a little bit about this facility or accessing its infrastructure, I'd encourage you to reach out to myself, Kate, or Mike Kovacs as the director of this facility. Across not just Lawson, but encompassing facilities at LHSC and Western, we have a number of advanced imaging modalities. And again, this spans both preclinical and clinical research. Again, I have the specifics here, but I'll just highlight that this supports everything from fundamental discovery at the cellular level to first-in-kind human imaging. A lot of this imaging is done on main campus at our Robarts Research Institute, at the Center for Functional and Metabolic Mapping. So here houses our high-resolution MR imaging suites, including 3T and 7T and 15.2T MRI, many of which, when they were first installed, were the first of its kind in Canada, but also a very pioneering technology with a small animal imaging MR, a 9.4T MRI, which specializes in really high sensitivity and specificity in small rodent and primate models. So this is quite valuable for some of that early stage piloting studies, and is all done by certified technologists and scientists with extensive research experience. Western has a very strong reputation in cancer research. And again, I think this is because of our strong integration with our partner institutions and other research hospitals. So I don't have time to go in all of our research groups and centers, but I've highlighted three here, which have a core hallmark all in common, and that's the deep integration and collaboration between scientists, clinician-based scientists, as well as clinicians and healthcare providers to support translational research and innovation in patient care. So our Cancer Research Laboratory program is located within London's Regional Cancer Program and hosts 7 specialized cancer research units. Our Center for Translational Cancer Research, again, focuses on bridging that gap between laboratory research and clinical applications with a strong focus on integration with oncologists, and is led in part by our Department of Oncology within the Schulich School of Medicine and Dentistry. A lot of our work and providing patients access to clinical trials is led in part through the Gerald C. Baines Center for Translational Cancer Research, which is housed at LHSC. This is home to the Clinical Research Unit, which I mentioned, as well as things like the Ontario Tumor Bank, and again, really integrates clinicians and researchers to accelerate that translation in cancer research, but as well as its applications to theranostics. Oops, sorry. If you're looking for ways to opportunities to partner with Western and our partner institutions, of course, as a university, we're strongly interested in supporting workforce development, and I have a little bit of more detail on this on my next slide. The infrastructure that I've highlighted here can be accessed in a number of different ways, whether that's through fee-for-service models or different analytical platforms that can be accessed through co-development. We're strongly interested in working in collaborative research through working on early stage technologies or exploring feasibility through proof of principle projects, all the way through to supporting clinical trials and real world deployment of advanced theranostic therapies. So for those who might be looking to, hire a student or work with students directly, you're able to host a student in a number of different ways, including through internships, co-ops, or practicums across a number of different degree programs. This can be tailored based on industry needs. There can be some in-class learning as well as these specific co-op opportunities. So I would encourage you, if you're thinking about hiring, Western's Career Fair is this fall, October 21st and 22nd, and you can register now. There's more information on our website, or you can reach out to myself or Kate to connect you to the relevant people here at Western. For those industry partners who might be looking for space, I also want to note that Western is home to our research parks, particularly Western's Discovery Park is on main campus and houses the Stiller Center, which was purpose-built to support life science companies with very specialized lab space, and is a very close walk to University Hospital and some of the imaging facilities that I mentioned here today. So very conveniently located. And the last thing I just want to highlight as I get close to time, sorry, is our citywide London Molecular Imaging and Theranostic Training Academy. So this was, might look familiar, it was presented by some colleagues at the Canadian Theranostic Leader Summit earlier this year. And it's led by Dr. Narinder Paul, our citywide chair chief in the Department of Medical Imaging, and Ryan McDonald, the director of the Department of Medical Imaging. And the goal here is to establish a formal, scalable training ecosystem for radioisotope therapies that address key workforce gaps and quality standards across Canada. So this can look like, short course intensive training for medical professionals like physicians, nurses, physicists, or pharmacists, which I understand to be underserved nationally, to more specific training for things like support roles and scientific experts, as well as technical specialists like computer scientists and biostatisticians, so that theranostics can take advantage of all the advancements that AI and big data provide. This will leverage all of the infrastructure I've already kind of mentioned, so I won't go through this again. But I do want to highlight that this training academy does look across the innovation pathway of theranostics and integrate strongly partnerships with industry, educational bodies, and governing bodies, so that this key training will help create standardized accredited training in a way that is championing patient care and quality standards that is clinically relevant and feasible to deploy. So with that, I'll open it up to questions and just highlight our contact information of myself and Kate Placid. We are very excited to answer any questions you might have, as well as connecting to some of the experts that we mentioned here today.
Thank you very much, Erin, for that presentation. As mentioned, we're going to open things up to questions and discussion now. I will mention that the CNIC team was very happy to participate in a tour hosted by Western of all the London facilities last year, so I can definitely attest to the expertise coming out of London. So perhaps I'll kick the Q&A off, and if others would like to unmute themselves or hop in, please feel free to raise your hand or to drop your questions in the chat. Erin and Kate, I'm wondering if we could circle back to the nuclear hub, if you could talk a little bit more about that and what some of the opportunities for the industry partners and the healthcare individuals that are on this call to support that hub, and just talk about what the primary goals to achieve with that hub when it comes to workforce development.
Sure, I can start and I'll let Kate jump in because she's the lead on this file. But the Nuclear Hub is really meant to be a connection point between industry, academia, and government. And so we're always open to help facilitate some of those conversations. Particularly, I think a lot of our focus lately has been on understanding like the workforce development needs and how we can help champion that within the Western ecosystem. And I'll turn it over to Kate, who probably has a lot more and better things to say.
The idea of the Nuclear Hub, we launched it in April of 2024, and really we brought industry partners and our faculty members to the table at the same time to say, what are the challenges in this space? Where can we go? And really kind of have that back and forth between industry and faculty. I think sometimes we don't always get those connection points, but the idea of the Nuclear Hub is to make that opportunity for those connection points and to make that opportunity to say, maybe these are some of the challenges that industry are trying to solve right now that could use some help. And these are some ideas that academia has, or vice versa. And I think that there's huge opportunities there. But the nuclear hub, again, it's really meant to be that connection point and that cross. It's not a physical hub. It's more of a people centric. How do we just bring connection across the work that we're doing in the nuclear area?
Thanks
And I
to you
should
both.
say, sorry,
Go
sorry,
ahead.
just to add on, I was going to say we focused a lot in our description about industry, but it's also about building connection too, because I know there are some other academic institutions here with the relevant complementary expertise across different institutions in Canada and internationally.
Thanks to you both. That it really is such a fascinating and really great initiative that you have coming out of London. One more question before we go on to our next presenter. I know that Western has a lot of collaboration with other institutions across Canada, a lot of other leading research facilities like Triumph. Can you touch on a little bit about that in terms of how Western is collaborating with other institutions to advance different research?
Sure. Do you want me to start, Kate, and then you can jump in? I think we are collaborating in like a number of different ways, and maybe Kate can highlight some specific projects. But what I will say is specifically for other academic institutions who might be on the line is that our approach at Western is not to lead everything, but to understand how we can contribute meaningfully within your own ecosystem. So we're very happy to partner on, different types of grants. A lot of what we're doing, you can see highlighted here, isn't all Western. It's with Lawson and LHSC. And often all of our faculty are working with, collaborators who might be on the call here today, like at Ontario Tech, at MAC, at UHN. So we are deeply embedded in the ecosystem. Is there anything in particular you want to highlight, Kate, as no? Okay, then I'll just leave it at that.
Perfect. Thank you, Erin and Kate, for sharing about Western. Up next, we're going to transition to our next presenter. Coming to us from Hamilton, McMaster University has been at the cornerstone of Canadian nuclear research for over 6 decades. McMaster is home to a powerful research reactor as well as a state-of-the-art cyclotron facility, but is also, as many of you will know, a leader in training in nuclear sciences with various training programs, workshops, initiatives aimed at providing opportunities for students from all backgrounds to learn about careers in this field. Please welcome Dr. Karen Stevenson, who is the Director of Nuclear Research and Education Support for Nuclear Operations and Facilities at McMaster. Over to you, Karen. Oh, Karen, you're on mute.
Nothing could be perfectly smooth. Okay. Thank you so much for inviting me. I'm excited to talk about McMaster today and also to hear from all of the other presenters about what's going on at their institutions. I feel like and then I always pick up little nuggets along the way. So McMaster University, for those that are not aware, was established in 1887. We have just under 40,000 students, so it's a mid-sized university. We are ranked in the top 100 universities and top 40 in the world for global impact. But probably most important for this particular talk is that it's one of Canada's most research-intensive universities. We are Canada's nuclear university with the reactor. It was built in 1959, really under the guise of Dr. Harry Thode. He established the McMaster nuclear reactor in 1959. He was involved in the Manhattan Project and had a real vision for McMaster to be a nuclear research powerhouse for Canada. We also look towards Bertrand Brockhaus, who won the Nobel Prize in 1994 for his work on neutron radiography. And we still have some of those instruments in the reactor today. We have a suite of world-class facilities that make us unique in Canada. So we have the McMaster Nuclear Reactor, the Center for Advanced Nuclear Systems, which is a post-irradiation examination facility and unique to a university campus globally. It is capable of handling a variety of very radioactive things, and sometimes we'll do isotopes in there, but it's also for materials research. We have the McMaster Accelerator Laboratories. We have over 10,000 square feet in our high-level lab facility and the largest consolidated license in the country. We also have Trace cyclotron facility, as well as the Canadian Neutron Beam Laboratories. And all of this is run by and managed and operated by the McMaster Nuclear Operations and Facilities Groups. We also have a core to clinic commercialization vision. We have the most nuclear-enabled innovation park. We're home to Fusion Pharmaceuticals, now AstraZeneca, the Center for Probe Development Commercialization, as well as Laurentis Energy Partners. On the main campus, we host Atom B Global Radiopharma, and they're building their new facility just out by the Hamilton Airport, and there's a picture of it there. I always like to, when we talk about radioisotopes, go back a little bit to the history. And before we were using anything nuclear for energy, we were actually looking at radioisotopes in medicine. And so it would be a shame to not talk about what Marie Curie was doing in the very early 1900s, as she was already developing needles for brachytherapy. And those needles have become incredibly valuable, as they are now the radium-226 is being harvested as a precursor for isotope production for actinium-225. So it has kind of come full circle. We have a near universal radionuclide production at McMaster. So we produce isotopes on demand for faculty and research and industry to do translational work. And so all of the little circles here are isotopes that we have made at some point, either on the cyclotron or in the reactor. And if anybody's interested in any of those, please reach out. Iodine-125 production is our largest commercial production. So it actually probably saved the reactor in the mid-1990s, as we had patented design to produce I-125, and it was a business case was developed, and now we're treating over 70,000 cancer patients a year at McMaster and have 60% of the global supply, and we are shipping it around the world, the furthest being New Zealand. It would be remiss if I didn't talk about the success of Dr. John Valiant, a McMaster faculty member who just recently retired, and the development of Fusion Pharmaceuticals and the translational work that was done here at McMaster and going through the development of the Fusion's Fast Clear linker. So medical isotope research expansion, we're looking to be able to do more as Canada's only neutron source for research. We're looking to expand. So we expanded through the CIF funding and the provincial funding to go to 24 hours a day, 5 days a week at 5 megawatts. This year on May 15th, 2025, we received 15.5 million in order to further expand to now go to 24/7. What this allows us to do is it increases both the capacity and the diversity of radionuclide production at the McMaster nuclear reactor. It expands our commercial production isotopes and also will enhance materials research significantly by being able to have access to more neutrons. The way that we approach supporting research through facilities is really 3 different ways. We have a team of staff scientists and research scientists within nuclear operations and facilities where we can do a full service research, and we can do projects executed in the facilities for industry or academia. We have supported research projects, which is where we bring the students in, or we bring in industry members in, and we kind of do it together. And ideally for students, what we want to do is be able to have independent research where we train them up to be able to work on their own in the facilities and be able to accomplish their own research projects. We have academic partnerships, industry-sponsored research, as well as an internal research program. Some of these are the partners that we're currently working with, and some of the isotope production that we're doing routinely at McMaster that might be of interest to the community. When I flip over now to looking at nuclear research and education at McMaster, we have full-time professors. We also have full-time research staff dedicated to the facilities. There's PhD students, undergraduate courses, as well as graduate courses. One of the things that the university recently did was launch an interdisciplinary minor in nuclear studies and society. The nice thing about this program is it is campus-wide. And there are 3 streams. There's nuclear engineering, focusing more on energy, nuclear applications in applied and medical science, which is really more nuclear medicine driven, as well as a general stream. And if we look across the whole nuclear sector at all of the support and staff and workforce training we're going to need, we need more than just engineers and scientists. We need everybody. So it's exciting to see this program launch in the fall, and it is already quite successful and overwhelming in a number of students that have already signed up. So one of the things that I enjoyed the most is doing hands-on training and using our facilities to train the next generation of leaders in the field. And so this is the second time we have offered this. It's we call it Next Generation Nuclear Medicine, and we co-host it with King's College in London. We reach out to sponsors, and we thank CNIC for sponsoring us 2 years in a row so that we can offer this to be at no cost for students. And over the last 2 years, we've trained over 50 students. They've come across Canada. We've had students come from the UK, Italy, Switzerland, and France. It's a blended learning model where we have about 3 or 4 hours of lecture and 3 or 4 hours of hands-on learning where they're actually making radionuclides. We do contamination exercises, tours, hot cell training. And we also present them with a case study on emerging radioisotopes that they have to defend at the end of the 3 days. The nice thing about this is when we bring everybody together, there's such great discussion and relationships made between the different students, and as well as going, oh, I didn't know you could do that. And because we offer it from a core to clinic to commercialization, wherever your research wedge sits, you're able to get a whole view of the whole industry from the beginning to the end. What this kind of looks like from hands-on is they will build targets for cyclotron production of radionuclides. They're going to make medical isotopes using our neutron activation analysis facilities. We'll do some neutron radiography to be able to see other things that are going on in the reactor. They do this radiation safety decontamination where we use gallium-68, and we train the students on how to clean up spill. We'll do SPECT and PET image analysis, as well as do some hot cell manipulation and training. So they really have a fulsome hands-on experience. We also just hosted the IAEA's Lise Meitner program. This program is named after the Austrian-Swedish physicist Lise Meitner. It's focused on a 2-week experiential learning and professional development opportunity for students from around the world. We had students from really all the way across the world, from Mongolia, Kenya, Ghana, Argentina. It was probably the most diverse group that I've ever worked with. But one of the things that we developed for them is to have a mini nuclear emergency experience. So you see them down here in their yellow, they're actually going out they were to set up perimeter and grab air samples as if we were to have a nuclear incident. So it was a great training opportunity for them and adds another component to the experiential learning we're able to offer. We're piloting this program this year. It will actually take place next week. We call it Nuclear Energy and Radioisotope Development Camp. It's focused on high school students, then grades 9s and 10, because that's when they have to decide whether they want to stay in science. And so we want to get those students before they choose not to take science anymore and limit themselves. So it should provide a unique, one of a kind, hands-on interactive learning opportunity. We're focusing on our Indigenous youth, and the first one will be with the Saugeen Ojibwe Nation, where we have 20 grade 9s and 10 students coming next week, along with 4 chaperones. And then the nice thing about the program is in parallel, we can run a chaperone program. So we're targeting both the teachers and the parents that want to come, as well as the students. And thank you very much. Any questions?
Thanks, Karen. We do have a couple of questions that have come into the chat here. I see a question from Andrew who's asking if it's possible for students outside of McMaster to participate in the programs, in specifically the Next Gen Nuclear Medicine program.
Yes, we only have a couple of McMaster students. They're all from this year. They came from Ottawa, Western. We had a few across Canada. So absolutely, yes. We will launch the application process probably next January or February, and then the event always takes place in June, usually around another meeting. So we kind of try to limit the travel.
Thanks,
Double
Karen.
travel.
I just wanted to ask a question kind of looking into the future. Considering that you're just launching the nuclear minor now, but recognizing that something that you said was very important, that we don't just need engineers, we don't just need folks that are in health studies, we need everybody of all backgrounds. Thinking about the future and the success of the launch of the nuclear minor that you've already seen, and the program hasn't even really started yet, what do you think comes next for McMaster in terms of engaging more students from a wider range of backgrounds and trying to really increase those numbers coming into the program?
Well, that was the exact challenge I got about 6 months ago. How are you going to do that? So The nuclear minor really addresses McMaster's specific needs because you would be a McMaster student to be able to take the minor and all the courses that go with it. The next step is to expand that to students across the country. So one of the things we're also hosting is from the UK, the Center for Doctoral Training Saturn program. They're sending all of their PhD nuclear students to McMaster to have a 1-week experience at McMaster and 1 week at CNL. And I've asked the question, why can't we offer that to all of our Canadian students? So that is underway to be able to open our doors, to be able to give other students that hands-on experience in making medical isotopes and doing all of the things that we want to do along the way, even in making a radiopharmaceutical. We're also supporting the training of Mohawk is launching their nuclear medicine technologist program. So all of the labs and the hands-on training component will be happening in our nuclear facilities. So we're working with Mohawk in order to expand that. And they're also looking at a smaller 8-month fast track program, working with Novartis to be able to do all the hands-on component as well as at McMaster. So in all ways, we're trying to open our doors and work with other institutions to have more students be able to come and train and at least have an authentically nuclear experience at McMaster.
So you mentioned Novartis there.
Yeah.
So obviously part of the work that the CNIC tries to do is increasing collaboration between all facets of the sector across industry, academia, healthcare. I'm curious if you could talk about the ways that McMaster is collaborating with the broader sector and industry partners in particular, kind of branching on what you mentioned about Novartis.
Yeah, so that happens in all of our sort of research pillars and depending on what the industry is. So most want to access the facilities in some way. So we do a lot of translational scale-up work because of the nature of our consolidated license. We're able to work with a new radioisotope relatively quick and then translate it up to full containment level and be able to then get through the GMP process as well. But even on the other side with, we're looking at developing new automation techniques that are going and be able to build into hot cells because we have access to 3 different styles of hot cells. So we have one that you can drive into, and then we have the post-radiation examination facilities, as well as a number of radiopharmaceutical style hot cells in clean rooms. So the full translational piece. So we engage in commercial contracts in lots of different ways in supporting different aspects of them, whether some want a radioisotope that they want to test with their molecules. I would say that we have quite a few of those. And then also in academia, it's more academic partnerships and collaborations, but we always try to, it's usually they want to irradiate something, and then we look at all the ways that we can support that work to happen.
Thanks, Karen. Just want to take a moment to flag our Isotopes for Hope podcast. There is a really great episode that features Karen about McMaster. So if anyone's interested in learning a little bit more about the work going on there, I'd definitely recommend you check it out. Just want to take a second to thank you again, Karen, for joining us and for sharing this presentation. I'm happy now to introduce our next speaker from Ontario Tech University. Ontario Tech is working to address current and future workforce demands by offering programs that introduce students of all aspects of the nuclear fuel cycle and a wide range of nuclear sciences. Ontario Tech is also home to Canada's only full-scope CANDO training control room. Very interesting fun fact. Here to talk about all the good stuff happening at Ontario Tech, please welcome Director of Continuous Learning, Chris Hall. Over to you, Chris.
Thank you. Let me share my presentation. So I'm Chris Hall. Just a caveat before we begin, I'm the Director of Continuous Learning. So my expertise tends toward the training, corporate training, and professional development side of Ontario Tech University, but I'd like to give a brief overview. And thanks very much for having me today. So our university, Ontario Tech University, which used to be called the University of Ontario Institute of Technology, but we went through a rebrand a few years ago. So we're modern and forward thinking. So we're 22 years old now, and we've grown into one of Canada's youngest research intensive institutions. And obviously with our brand, STEM is at our core. We strongly focus what we do on science, technology, engineering, and mathematics, even in our summer camps, which are part of my responsibility here at the university. So we're really aiming to equip our students with skills and mindset to lead in high demand sectors, including the nuclear sector. And I'm going to take the opportunity to promote a program that I've been working on quite a lot these days, and I'm very excited about at the end of this. So I hope you don't mind. We're located in Oshawa, Ontario, and we're really playing a vital role in driving innovation, education, and economic growth. We share a campus with Durham College as well. So we have an applied side to the house in a way. We're two separate institutions, but we have quite a lot of shared services, which has been very beneficial recently for both institutions. We have 12,000 students across undergraduate and graduate programs, 6 faculties, including engineering, applied science, business IT, science, health sciences, education, social sciences, and humanities. But even the education, social sciences, humanities faculty do tend to approach everything from the lens of STEM, science, technology, engineering, and math. New statistics for us is that 96 of our programs include experiential learning opportunities, and we have a whole new department that helps our learners find ways of either connecting with employers or in our applied labs. And we were recognized in 2024 as Canada by Research InfoSource as Canada's Research University of the Year. So in terms of nuclear education, in some ways, we're the only one of its kind in Canada. So we are currently Canada's only accredited undergraduate nuclear engineering program, and we have a new minor in nuclear technology for science and engineering students only. We're ranked one of the top 3 institutions in North America for graduating nuclear engineering undergraduates. We have the Energy Research Center, which features our CANDU simulator for nuclear generation. We have the Brilliant Energy Institute, bringing toward researchers, students, and industry, and quite a few labs supporting training, research, and real-world application. We are in the process of not building, but in the design phases of installing a or a subcritical nuclear reactor on campus. It's going to take years, of course, but a subcritical reactor will allow us to do, and I'm not a nuclear scientist, engineer in any way, but will allow us to do research that might not be able to be done otherwise. And from my perspective as Director of Continuous Learning, we do comprehensive talent development. So we're from undergraduate all the way up to mid-career professionals. So the program that I wanted to, and I'm most excited about, is something called the Nuclear Career Accelerator. And this is a program which is a 12-week program which is being funded by Pallet Upskills Canada, which is funding through the federal government. And we have 7 industry partners that worked directly with us in the design and development of this program. So they will be hiring our learners who complete this 12-week program. It is delivered through Ontario Tech's Department of Continuous Learning. It is a program that is designed to transition engineers, scientists, and technical staff from outside of the nuclear sector into the nuclear sector in a short period of time. So our industry partners expressed challenges in integrating engineers from other sectors into their departments. So you have certain industry partners, and I don't think they'd mind me saying, like Aecon, saying they're transitioning 300 engineers into the nuclear sector. It is a peculiar industry, a different industry, and any kind of preparation that we can provide for their teams in advance is going to help a lot in retention. So it's a 12-week program. It takes 12 to 15 hours per week for our learners, and we will have 2 cohorts starting in September 2025 and the second starting in January 2026. And thanks to the Government of Canada, we can subsidize our fee at $500 per learner, which is significantly less. And as some of my colleagues here know, nuclear training can be very expensive due to the cost of our subject matter experts and other facilities and all of that. So this is very, very low cost training that we're providing for those outside of the industry who are looking to move into the sector. And there are 11 courses, 4 of which are core, and then in consultation with career advisors, they would choose 3 additional courses. So the core courses are listed here. You know, the physics, how important nuclear energy is, and nuclear power, nuclear generation, nuclear isotopes is in society. The overview of how nuclear generation works, regulation and safety, which is actually a theme that runs throughout the program, and then a variety of different electives. So this program is very excited about almost 350 applications in 2 months for the program. We're in the middle of evaluating, trying to make sure before we accept people that there could be a potential employment at the other end. Because that's part of the program, is that each learner gets 6 months of career support once the program is complete. So our audience for this program tends to be engineers and technical staff with 3 or more years of experience. So anyone here who has colleagues in other sectors who are looking for potential job shift to nuclear, this could be an interesting stepping stone for them. And yeah, if you'd like to reach out, nca@ontariotechU.ca. Thank you.
Thank you very much, Chris, for that great presentation. I have a few questions, but I will open it up to the audience as well if there's questions from our attendees as well. I just wanted to ask a couple of questions about the Nuclear Career Accelerator program in particular. Sure. I think that's just such a fabulous program and a really great opportunity to help upskill and retrain individuals who might be interested in careers in this field. I'm curious if you can talk about what the future of that program looks like, if there might be other opportunities for some of the other industry partners or healthcare partners that are on the call today who are not on that list of other great companies that have already gotten involved in it, if there will be future opportunities to engage with that program.
We will be hosting career events for the learners in both cohorts in the fall and in the winter. And if you write to that email, nca@ontariotechU.ca, you certainly are welcome and would be included. Obviously, our industry partners will be there, but we will have opportunities for others as well. We will have, you know, we're going to have career supports, so one-on-one career supports with our learners. And if you have potential positions that you're posting for that might be a challenge to hire for people mid-career, you know, not right at the beginning of their career. In this case, we would be more than happy to post them and send them out to our, you know, to selective learners. So we'd try to reach out to learners that meet some of the requirements or all of the requirements of your posting. And in the future, while the program is subsidized right now, we're building it 2 ways. And one of the ways that we're building is it so that it can be asynchronous with facilitators. And there will be a variety of different learning approaches to that, some traditional recorded kind of lectures, but also, you know, more modern approaches to asynchronous learning, so that we can keep costs lower for our learners, and break it up so that you don't have to take all of the courses. You could take certain courses that might interest you. Particularly the safety and regulations course would be very, very interesting to, you know, to just about anybody who's interested in working in the sector.
Thanks, Chris. Certainly a really great opportunity. So I'd encourage anyone on the call who's interested, whether that be in terms of engaging with the learners themselves or becoming a learner, I'd certainly encourage you to reach out. The other question I had, Chris, for you, and it goes back a little bit earlier in your presentation, and it's about experiential learning. So I don't remember exactly what the stat was, but it was pretty close to 100% of students have some sort of experiential learning component that's built into their programs. I'm wondering if you can talk a little bit more about that in terms of folks that are interested in nuclear sciences or isotope careers, what those experiential learning components might look like.
It's a good question. The obvious and the biggest percentage we're aiming for would be involved with our co-op and careers department, where we're actually placing learners to do, either placements throughout their employment. Any work that can be done in any of our labs is also considered experiential learning. And then certain faculty embed experiential learning directly into their courses, so more hands-on type learning. So that's how we get to the 96%. It's not just working in the industry. There's a variety of different elements around that.
Thanks, Chris, for sharing.
If there are specific questions about how to get involved with the university along that score, how to work with our learners, students, undergrads, graduates, applied research, anything like that, you can email me directly, or the NCA at OntarioTechU.ca will get to me as well.
Perfect. Thanks so much, Chris, for the great presentation and for answering the questions as well. Last but not least, we will turn it over to our final presentation for today. We will be hearing from the Michener Institute of Education at UHN, which hosts a really unique model for educating health professionals and for designing training for future health professionals. Importantly, Michener offers Canada's only nuclear theranostics course. Here today to talk about the work that Michener is doing is Adam Zaleski, Professor of Nuclear Medicine and Molecular Imaging Technology and Radiation Safety Officer at the Michener Institute. Over to you, Adam.
And you can see my screen?
Yes.
Perfect. Okay. Thank you very much. It's my pleasure to meet with everyone today. And it's wonderful to hear about all the different things every institution is doing. So just quickly about me, similar to the students that come to study nuclear medicine technology, my background is a bit different. I actually studied physics at McMaster and had the chance to visit the reactor. It's wonderful, open to the public. Definitely recommend if anyone has had a chance to be there. And I've had experience too working at STAR, doing small animal research and working with people as a nuclear medicine technologist at Halton. So currently, like she mentioned, I am an instructor for nuclear medicine, and we are the people that essentially are the people that are the end users, essentially, you can think about for all these isotopes. So for our program itself, it is very small, and there, in general, currently are only about probably around, let's say, 5-6 programs total. I think McMaster is working on their own nuclear medicine technologist program. And there's a growing need for our MRTs. And so exactly what does a nuclear medicine tech do before I move on? We are the ones that are helping give those ingestion, and inhalation of these materials. And we're doing this for the physicians and the healthcare team. It's a bit tricky sometimes with physicians having to do certain types of injections. But essentially, we are focusing on the physiology, as you know, as compared to CT, where we're more looking at anatomy. So things are getting very specialized. Obviously, PET, hopefully, is going to continue to grow. So one of the challenges in terms of teaching a program is the technology isn't available everywhere in Canada. And I'll be going over that in a second. But our program is fairly old. So it started in 1972. And like many of your institutions, I think Ontario Tech, we've gone under many name changes. So this changes. Now we're affiliated with UFT. And a little overview how the technology has changed. So we've gone from a single detector to a dual detector. We've gone to hybrid imaging, combining obviously with CT and with PET CT. And the huge thing everyone's talking about is theranostics. So over here you can see on the right side, for those of us not in medical imaging, we see the general nuclear medicine image merged with the CT image, gives much more information for the reading physician. Now, when we have technology, transition is quite difficult because if you're doing research, maybe you have that around, but when you have an educational institution, the funds aren't always there. And in addition to getting the technology, for it to be even accepted for what has to be taught for all technologists around the country, there's a bit of a delay. So even speaking of the CMRT right now, all of us know theranostics is going to be the future. But that's not actually mandatory for what our clinical placements have the students do, because not everyone has access. So they don't feel comfortable saying, you have to get this done, because not everyone can do it. Maybe they're at a site that doesn't have it, and they actually have great difficulty getting those competencies. So when we get our new technology, and actually we're getting some right now, we teach not just nuclear medicine techs, we teach rad techs, we teach radiation therapists, and we started an MRI program. And they're currently installing a CT machine just above us. So it's an old school, which means they didn't plan on machines weighing so much. So they're actually having to reconstruct a lot of the stuff around here. So this is challenging from our end. The gaps we have is PET, because I said it's not commonly available everywhere just for teaching for many reasons. Our isotopes, they're expensive, short-lived, and they give a much higher dose. We're all familiar with Alera. We cannot justify just using these expensive isotopes that would be better used for the patients at UHN than our traditional nuclear medicine cameras. So we have a lack of access to some of these machines, and our students do go through PET rotations, but still there's limited availability. As we all know, we've all mentioned the understaffing for across the board for many different roles, and we're no different. So we can't just have infinite clinical placements where we have the new technology. We are affiliated with UHN, but our students go to sites around Ontario. So you might be unlucky and not have access to the entire placement that you have to these machines. So again, I know most of us do know this here. I know Wilfred's actually here. He gave us a wonderful presentation to the students for PSMA. And we have been teaching this in our classes a bit, but things are going so quickly. When it's not mandatory to teach as a competency, when you add something in, you often have to take something out. So we obviously have our theranostics, a visual for everyone who hasn't seen it before. The advantage is that we can obviously use it for imaging first to see if our patients are good candidates for the treatment. And then if they are, using the healthcare team, they decide we actually can give them the therapy. The way these are done, though, uses a lot of equipment and technology that is quite expensive. We all know lead is expensive, tungsten, and even the special shielding is at tens of thousands of dollars, which is really not always available for us. So on the right side too, just an example of when we are treating certain types of liver cancer, where we have the catheter, and we're looking to see if the tracer, to see if they're good candidates, if the tracer goes outside of the liver. So if it goes to the lungs, too much of it goes to the lungs, they might not be a good candidate because we would cause damage to them. So theranostics is clearly the future, but we have a lag. So the challenge for us is kind of, how do we prepare the students going into the workplace? We are looking at the students going, and some of the clinical placements, like I mentioned, they do get hands-on. They're working at the UHN sites, or they're working at Sunnybrook, but maybe they have a placement where they don't have it. So what do we do? On our end, we are now offering a course that's specific for theranostics, recently made. So Julie Sitt, she is very important at Sunnybrook. She does everything there if you've ever met her. She's recently teaching. It's our second running of this course, because not only is this not available every site for our students, you think about the current technologists practicing. How do they get trained? So a lot of people are looking for these types of theranostics courses. So finally, we're happy that we can offer this. And they cover everything from, the physics of PET to finally theranostics. I'll go into a bit more detail here. So the very least we could do, we at least have our course to teach the theory. So we start from the beginning, from a tech side, what does a technologist need to know? Learning that instrumentation, learning those quality assurance protocols, knowing those principles. And for us, because we're medical radiation technologists, we have to learn the appropriate patient care and understand the image quality in the actual situation. So very, very applied is what we are teaching our students. So on the right side here, for example, we see a normal uptick for a patient with FDG. And so as a technologist, for example, when we are learning these things, if we see something that's an artifact that perhaps we can fix, or perhaps it is pathology, we have to be trained to be able to do this. So the second course is about PET methodology, more focusing in on the diagnostic procedures with PET. So this is really in our wheelhouse, doing a scan for diagnostic purposes. I did want to emphasize that because as we move through theranostics, I'm not sure if we've heard that there is a lack of technologists. And because theranostics is using therapy, there are talks about from the college, well, who's actually responsible, who can be responsible for giving the therapy? Should radiation therapists also be involved in this as well? We don't know this yet. These are discussions that are happening a lot of places. So traditionally, we have been using with iodine-131 therapy, but this is a whole new beast, and we would like to grow and ensure that all hospitals or a lot of clinics can do this. So our final course here is going through all of those new advancements in these theranostic procedures. So this is open to the public, or if you know a technologist at a site that wants to know. And this probably would make it easier for sites to adapt and be able to start offering these too, once we get more PET scanners too. So I kind of just wanted to finish off here, just emphasizing on our end, we are happy to offer these courses. Theory is covered. These are very recently made courses. They'll obviously need to be more updated. And we do have to filter in through all of the research that's being done, and we have to make it what the National College says it's appropriate. But it's like the chicken or the egg. It's quite challenging for us. And on our end, it would be nice to make stronger links with these pharmacy companies so that we can actually use some of this very expensive equipment to better prepare students that are graduating. So really, this is the final end users kind of using this amazing research that everybody is doing. And likely that sites like ours, we're not going to get a PET scanner on our own, but everything else surrounding it, the procedures themselves that are being used, it would be nicer to collaborate with everyone to see what is being done, because even the clinical sites that are doing theranostics, they're often still learning too. So these are the challenges that we're facing as technologists in this field with these isotopes. So yeah, thank you very much.
Thank you, Adam. If anyone has any questions for Adam, please feel free to raise a hand. I see Karen has raised her hand. I will pass it over to you, Karen.
Thanks. I really enjoyed that, Adam. It was super interesting to me. I'm curious as to what you think the numbers and the needs are in order to be successful in this rollout of theranostics across Ontario and the country.
Well, it's so weird. We do have meetings with our clinical sites, and you just see the number of postings made. And even talking to our clinical site, it seems to vary. It comes in waves of who you need. But the numbers, our program currently, we are expanding to about 40. We want to be open to 40 per year, at least here in Ontario. And in terms of, I'm not sure about the other schools in Canada, but it is very few schools, I think. Yeah, just 5, 6 total. So the numbers, yeah, we're graduating currently though about 22, 24, and tons of postings for nuclear medicine techs. So it comes in waves though, like before, I'm not sure if you heard, there was an overabundance of nuclear medicine techs, the technology advanced, and then we're like, oh, we need them right away. But it takes about 3 years to graduate. So it's really challenging to keep up with everything as it goes.
Yeah, thank you. That's really interesting. I had heard a stat that something like 50% are going to retire in the next 10 years. It was staggering. Yeah.
Yeah, we keep hearing that too. And yeah, it's very site dependent. Some sites have like a wave of people retiring and scrambling afterwards. And the challenge I just wanted to mention is when there's a role that we can't fill, I think they often look for other healthcare professionals to see if they can do what we do. I know America, they've had a shortage of nuke med techs, and they were telling me, I was at the SNMI, they said they were trying to use certain nurses to try and give the injections with bad results, the nuke med people were telling me, but they are looking to other health professionals if they have too much of a shortage.
Awesome, thanks. I had heard about the nursing and whether they were going to push with that too to see if that would help meet the need in the short term, but It's crazy. We have all the development and then you want to execute. And if there's not anybody there to do the injection, then that is like a hard stop.
Yeah. And I see, is there another question? Yeah.
Thanks, Karen. I have a question in the chat here from Jacqueline. Do you have any need or want for guest lecturers who have done clinical theranostics? If you're covered there, is there any need for equipment and simulation? I think that was getting at some of the things that you were mentioning at your end slide. So if you could just answer that one.
Yeah, because we just have the newly launched theranostics course, Wilfred actually gave a guest lecture. I think it would be quite good to have guest lectures. You know, herding the students into an area is the challenging part. I think it would be nice if we had more guest lectures from other different types of theranostics. And the equipment is a huge, huge need. We are doing what we can, but it is quite difficult to simulate and use theranostics on its own. So yes, please get in touch with me. I think I don't have my email here, but if you have that in the email, Melody, I'm not sure of contact after.
Anyone that would like to get in contact with any of our presenters today, feel free to email anyone from the CNIC team, whoever you heard of this event from, feel free to reach out to us and we can connect you with the right people. The only other question that I had for you, Adam, and it's branching on some of this conversation around wanting to have stronger links with the different companies. I'm curious if there is anything that you're looking for from healthcare partners in particular. I know that there's a lot of questions around where the demand is heading, where the demand is highest. So how can the healthcare partners and those that are more on the end use side support the work that's going on at Michener?
In terms of, can you be more specific with that? Like supporting the need or?
In terms of whether that's contributing data, contributing demand, providing placements, providing opportunities for clinical
I would
experience.
say one of the bottlenecks is the clinical placements. Personally, like I said, from my point of view, I can't speak for everyone, but when theranostics will become mandatory, I think it will be for placements. That's one of the reasons they aren't. Is like, it would be nice if we could build connections with all the schools to have theranostic placements to kind of say, okay, we currently have a PET placement, but if you don't have theranostics, there's like to do a placement with theranostics so we have more people trained. Would be nice. And then the CMRT can say, okay, we do have everyone access to do these. So clinical placements are huge, a huge help. Thank you.
Great. Thanks so much, Adam. I see one other comment. Oh, that's just Amanda. As she mentioned, if there's any other questions that anyone has, feel free to reach out to us and we can help connect you with the speakers after the event. With that, I'd just like to thank you, Adam, again for sharing about Michener today and to all the rest of our 4 presenters for joining us for this web event. I'd also like to thank our audience for your engagement and participation. For those of you who asked something in the chat, I'd encourage everyone to keep these conversations going because deeper collaboration and alignment across academia and industry is truly the best way to ensure that we're meeting Canada's workforce needs for the future. Before I wrap things up, I want to flag a few upcoming opportunities to engage with the CNIC in the next couple of months. The first one being that we will be at the IAEA General Conference from September 15th to 19th, and we will be hosting a Canadian-focused side session to showcase the important work going on in Canada and some of the nuclear infrastructure and technology that is contributing to global health. If you'll be at the IAEA conference in September, feel free to reach out and we're happy to provide more information about that session and potentially how to get involved. A couple weeks later, we will be traveling to Barcelona for the EA&M conference from October 4th through 8th, where we will be hosting 2 more Canadian ecosystem-focused side events to highlight what many of our members are doing. We are also proud to be partnering with OCNI to host a trade mission to EA&M, which does offer some funding support for participants to attend the conference and some really unique opportunities to engage directly with the European community. Please reach out to us for more information on how to apply for the trade mission funding and to get involved in our side events for EA&M as well. With that, I'd like to thank everyone again for attending today's academic forum and to our presenters for sharing your work. We look forward to hosting more of these events in the future to showcase the work that more of our academic partners are doing. The best way to stay in the loop with us is to follow us on socials or subscribe to our newsletter. That means that you won't miss out on anything that we do in the future, whether that's a webinar, an in-person event, or another initiative coming from CNIC. With that, I will wrap things up for today. Thank you again, everyone, for attending, and we will see you at the next event.